Hello, and I've unmuted myself so I can properly join you. Thanks for joining us here today at the Australia-Indonesia Centre and our In Conversation webinar about data and what we are learning about its value in this strange and unsettling time of coronavirus. Before we begin, I'd like to acknowledge the traditional owners of the land on which I'm standing, the Kulin Nations. It's also the land on which the AIC's office is located and from where our panellist, Dr. Campbell Wilson, is joining us from. We pay our respects to elders past, present and future. Now, as you know, the Centre's mission is to build on the links between Indonesia and Australia. And one of the important ways we do this is by bringing researchers, industry, civil society, and governments together to discuss some of the important issues that we are grappling with, to learn about the challenges, the successes, and see where we can work together to have a stronger partnership in the region. And it's great that you could join us for this particular conversation. It's a bit geeky, it's about data, but data rules everything. And we don't need to be afraid of it, as we're going to find out. There are some ways we can use it better, and there are some ways we can maintain people's privacy in the use of it as well. But hey, is that necessary in this day and age? Let's find out. We've got three great guest speakers to help us with this conversation. Now, we are inviting questions. The chat function is off for the time being, but we will have that open for you in about, say, 20 minutes time. And thanks to those who've already sent through some questions, we'll pop those up on screen and have our guests answer them as well. Now, just to set the scene, so to speak, one of the things that the coronavirus pandemic has taught us is the value of accurate data and good science. But making those elements the priority does not always work in our human world. So we're going to hear what's being done to collect and analyse data and put that into some context around how that data is then being read out to the public, what messages are being given about it. We're going to look particularly at what's happening in Indonesia because there's so much interest in the numbers around coronavirus there. And all these issues are ones that our fabulous three guests are going to guide us on. And we're absolutely delighted to have them with us today. I'm going to get some opening comments from each of them just to help you also understand where they're coming from. And to start off, I'd like to invite Alina Chiptadi to speak first. She's the co-founder of COVID-19.id. That's a pro-data movement to provide Indonesians with accurate information on how to deal with the COVID-19 pandemic. Alina, so lovely to have you with us. I'm a big fan of your work, I have to say, you and your team, with the work that you do on elections. But this is a very different situation now. Can you just explain a little of what you're doing?
Yes, thank you for the opportunity, Helen, and well, from Singapore, good morning to everybody in this online space. Yeah, so a little bit about Kawal COVID-19. The core team of Kawal COVID-19 is the same people from Kawal Pemilu. So from 2014, so we are a group of pro-data people who was like united with the same purpose, under a common purpose, which was to give people access to data, to election data. So we work in tandem with the election agency. We did a parallel count of the presidential election votes. So this was 2014 and 2019. And we all do this in our free time. So each one of us has a day job to do, and we do this on top of our daily responsibilities. So, but we became friends over the course of the 5 years or so. And as data worms, as we call ourselves, we've been monitoring the data for COVID-19 since it first broke out in China. So we started in January just for our own use, just because we were interested in the data of how it spread, and what was it. We were reading journals and research articles, and we collected quite a wealth of knowledge just based on the available data in China, and then starting in a number of different countries that experienced the pandemic before Indonesia. So in February, after monitoring the data for a while, we realized that every single country was going to get affected. Indonesia, not the exception. And what we saw in Indonesia in February was a number of government officials made public comments that downplayed the risk of the pandemic, saying that it's not here, you know, kind of we're protected, we're a tropical country, it's going to be fine, it's just flu. So, and we were really concerned because people in Indonesia have the same access of information that we do because we use only publicly available data. And if based on those data, we felt like Indonesia is going to be affected in a big way and people are not seeing it because the government is not communicating the risk out there, then somebody needed to step in. So despite a lack of knowledge in public health, epidemiology whatsoever, then we decided to sort of like recruit a number of medical volunteers, medical researchers into our team. And then we launched on the 1st of March. And this was about 2.5 weeks before the government launched the government website for COVID nationally. So we felt that we had to step in because there's a lack of information leadership from the government. And essentially, that's what we do. We still do daily kind of update of number of cases, where they are, testing rate, positivity rate. We try, at least on a weekly basis, try to make the numbers make sense for people who don't deal with data on a daily basis the way we do. And the data that we use, we also create kind of white paper proposals on policy changes for the government. You know, bits and pieces have been accommodated and some others we're still working on it, but that's where we are at the moment. We have, and increasingly we work with local governments as well at provincial or city level to try to influence policy to make it more data-based instead of economic or kind of, you know, fast reopening based. And that's essentially what we do. And I believe I'll get a chance to explain more when the questions come. Thank you, Helen.
All right, our pleasure. Thank you. Now I'd like to introduce to you Dr. Campbell Wilson, the Senior Lecturer and Associate Dean International at the Faculty of Information Technology at Monash University, one of our founding partner universities, in fact. His expertise encompasses machine learning, information retrieval, and digital forensics. And Dr. Wilson, great to have you on board as well. I guess, you know, this time of coronavirus, it's quite challenging and frightening in many ways, but for someone who loves extracting information and learning from it, it must be an incredibly interesting time for you as well.
Absolutely, Helen, and thank you for the opportunity to participate, and thank you to the Australia-Indonesia Centre for organising this, what I think will be a really interesting discussion with colleagues from Indonesia. I guess I'm coming at this from a slightly different angle. I'm not necessarily working with COVID-19 data on the ground as Elena definitely is, but I do work with data, as you said, quite extensively. So I work in the Faculty of IT at Monash University, and my background is applied maths and computer science. My current area of research is applying artificial intelligence and machine learning specifically to problems of community safety and also how AI can be used in law enforcement. And to that end, I'm co-directing a research lab that's a collaboration between Monash University and the Australian Federal Police. And the core mission of that lab is really to do R&D in AI that can be used to address serious crime. And in particular, I've had quite a focus on technology that can automatically or semi-automatically classify distressing and illegal images that are distributed online. But more broadly, we're also very interested in exploring what the explainability of algorithms means in a law enforcement context and how that can be achieved. For instance, the use of machine learning is sometimes very opaque. It's hard to explain what the algorithm is doing and how it's making its decisions. And you could probably understand that in a law enforcement context, those decisions have quite serious potential ramifications. So it's important to explain how those algorithms work. And more importantly, and I think you picked up on it in your introduction, I think in this time, in this pandemic, it's probably very important to explain how data is used and any algorithms that are operating on that data, how they actually work. So I'm particularly interested in that. I'm also interested in the ethics, I guess, of data use in all its dimensions, particularly in the context of community safety, but definitely more broadly in COVID-19. So that's, I guess, where I'm coming from. And I'm very much looking forward to the discussion today.
Can we call you a data worm, Campbell? I think that's the term Alina used.
I love that term.
Great.
Very happy to be called a data worm.
I love learning a new phrase. All right, deal. I'd like to now introduce our third panelist, Petra Karecci, the head of the UN Global Pulse Lab in Jakarta. Now, this lab is at the forefront of developing systems that use data to help limit the spread of COVID-19. And generally, they've been doing lots of amazing work with other partners throughout the world on using data for better humanitarian outcomes, particularly when it comes to a disaster zone. We'll obviously learn more about that, but Petra, lovely to have you with us today. Tell us a bit more about what you're doing in Jakarta at the moment.
Thank you, Helen, and thanks for the introduction. I really would hesitate in saying we're at the forefront with data on COVID-19, but what we are trying to do based on our mandate, where Pulse Lab Jakarta was established in 2012, looking at where emerging or alternative data sources could be utilized by government for public policies. And so our work has been in looking at how we can utilize or better utilize new or emerging data sources. But and our experience is showing that it's the utility or the usefulness and validity of our analysis utilizing what we commonly call big data is when it's in combination with traditional or existing data sets gathered by government, and also with what they call thick data, which is based on experiences of communities and citizens. So in answer to your question, what we're doing at the moment is looking at how we can then combine data sets with regard to COVID-19. Where at the outset of COVID-19 in Indonesia, we thought we'd do a bit of a baseline and see how are local governments reporting on COVID-19, because we feel this is very important to build public trust in what the government is doing, and then so when there are new policies, citizens are more likely to adhere to the regulations and the policies. But what we found is that out of the 34 provinces, originally only 30, at that time, we only found 30 provinces that were really reporting with consolidated down to the district level. And what we're now seeing is that this number is actually dropping. So our latest data is that we have only 22 provinces that are properly reporting on COVID-19 publicly, that is. With data also collated from the districts. What we also did was looking at provinces where there is actually a strong data infrastructure or ecosystem, and so we've been collaborating with the West Java government, provincial government, which we've been very grateful to have this collaboration. And here we've been able to combine between traditional data sets such as PODES, which looks at village potential and highlighting vulnerabilities of villages based on the sanitation, the level of sanitation in the villages, and then comparing that, also link that to access to access to medical supplies and or medical services. but then combine that with data such as mobility data. West Java is using Waze data, and also combining this with Facebook data and looking at public demographies to identify where there are high risk populations due to the age, and also to the to the level of density in terms of age and their access and their location in terms of access to medical services as well. So, why we're doing this with West Java is also it shows what can be done, or what is possible if there is a strong data infrastructure. But then it helps us to then see or show to other provinces what really is needed if effective data systems can be applied to address issues at hand. So maybe I'll stop there, and really looking forward to the discussion today. Thank you, Helen.
Thanks, Petra. And I'll just pick up on what you were saying about some lack of data in some particular areas. Alina, are you finding that it is difficult to get a true and comprehensive picture of the spread of the virus, and some ideas of where the weaknesses in the system are? And then Petra, I might just go to you and get your thoughts on those provinces that don't have the capacity perhaps to report.
I guess, okay, in a lot of areas in Indonesia, testing capacity is very limited, and the world sees the number nationally that we still have one of the lowest testing rates in the world, even when compared to other developing nations. So, but some areas like West Sumatra, for example, Jakarta or Bali, their testing rate actually meets the WHO requirement. So at least they have the testing capacity within their province, and it's just a matter of bringing the positivity rate down to a point where it would be deemed safe to partially reopen, for example. So not every area in Indonesia is equal in their handling of the pandemic. West Java, as Petra would probably be able to tell you in greater detail, has not met the WHO requirement for minimum testing rate of 1 per 100 for 1,000 population per week when it comes to testing. The positivity rate is quite low, but we don't know whether that's because they're under testing, or is it because the spread is not wide anymore until we get to that testing rate. So that's what I can say. You know, kind of, we can definitely spotlight West Sumatra in their attempt to multiply the testing capacity of their of the province. We still don't know the full insight of what's happening in Bali, but you know, the testing rate suggests that you know, they have the capacity. They fairly recently were given a PCR machine, so their lab probably has capacity. Jakarta, as the capital city and the business capital of Indonesia, rightfully so, was given a lot of attention and a lot of support to make sure that the positivity rate and testing gets to where it needs to be to reopen. However, even with a testing rate that is 4 times the minimum amount required from WHO, the positivity rate is still somewhere between 9 and 10%. So, which indicates that community transmission in Jakarta is widespread. There's still a lot of cases out there that we don't know, most probably asymptomatic or pre-symptomatic. And in Jakarta, they don't seem to be coupling their testing capacity with tracing. So, you know, kind of testing is only one side of the coin. And, you know, if massive tracing and quarantine of people doesn't come into play, then it's just going to be a Tom and Jerry game of, you know, chasing new infections, but then the new infections keep chasing new people.
Petra, picking up on that, what gaps are you seeing in the infrastructure for the collection or the systemic collection and understanding of data?
Okay, thanks, Helen. I think reflecting on how the processes is usually in when there's a natural disaster, because of the sporadic nature, you can actually fly in qualified teams or competent teams to collect the data and do the assessments on the ground. Now suddenly with COVID-19, the pandemic, the scale of the pandemic cannot allow. Where are you going to send people, and do you have the resources to send? And so it really is, I feel, is highlighting where the capacity gaps that needs to be built and strengthened at provincial and district level, and also around the actual information infrastructure as well. And so hopefully that we can learn lessons from this process, and actually consistently build this capacity so that we are actually have this sort of a stronger resilience for future issues. But actually, even in handling this current issue at hand, I think one other aspect that we find has been problematic, I guess, is that a lot of protocols or agreements really need to be in place, before an issue happens. And an example is if we had protocols around mobile data, so that operators would share the certain mobile data, anonymized of course, but for instance, to be able to help around tracking of issues and just tracking of population mobility, that would be incredibly valuable. But as it is in the midst of a pandemic, trying to get some of these agreements or protocols happening, it's just so much harder without being able to meet face to face as well. So these are some of the challenges we're seeing as well, Helen.
Thanks, Petra. Campbell, if I can go to you, because I'm curious to know if there are gaps in the data, so to speak. How robust is it? How much can it be depended on to tell the story of what's happening?
Yeah, I think that's a really important question. If I could just, I guess, step back a little bit, I would tend to make a distinction between data, which is really the raw numbers, and information, which is derived from that data. And it's the information that conveys meaning and supports decision and policy making, etc. And that might sound a little pedantic, but the distinction is pretty important, because there's many methods you can use to transform data into usable information. This is what data scientists essentially do, and of course different information can be generated from the same data. None of that in itself is new. I mean, the field of statistics has been around for an awfully long time, hundreds of years, and computer scientists have been organizing data so that it becomes more informative pretty much since the advent of electronic computers, 70 years or so. So I guess to your question, whenever you're doing any analysis intended to make the data informative, there's always an issue of data quality. That's the first issue. So there can be a lot of noise in certain types of data. And yes, what the data is representing, or the information that it truthfully represents that underlies that data, can certainly be kind of misinterpreted, and there can be gaps. And even very simple analyses of data can be examples of that. And the classic example, I guess, is daily COVID-19 case numbers. And certainly that's something we're all hanging on in Melbourne right now. It's the same in many places. We see these daily briefings. And the thing about that is that without sort of moving averages and uncertainty being given in these estimates, day-by-day trends are not necessarily very meaningful. And worse than that, there's this kind of massive uncertainty underlying the data that's not really reflected in the public necessarily understanding what's going on. So, and to take up Alina's point, I mean, testing obviously is massively important, because while the number in a given day might be very accurate given the tests that were undertaken, it's obviously much less than the real number of cases present. And the amount of uncertainty as to what percentage of the real case numbers that represents is potentially huge. And, statisticians are experts at dealing with that uncertainty and understanding those variable factors. But the way that is presented and the way that it's presented to the public is that a lot of that context is often lost. I mean, it's not always easy to present it in that way with that context. But I think this is a really big issue, the way that the data is interpreted, and certainly there can be gaps that are hard to observe.
I think that's a really interesting point, and we'll get back to that. I've got a question actually from one of our audience members on that. Before I go to it, I just wanted to get a picture, Alina, and also from you, Petra, where you're getting your information from, because you've mentioned social media. Petra, you mentioned Waze, which is an app around mobility. I think, Elena, you even talked about having people attending press conferences to try and get numbers. So, Elena, I'll go to you first, just for a quick rundown on where the information's coming from, and then to you, Petra. Thank you.
We get all of the data that we collected is publicly available. So the data may not be uniform province to province simply because they present the data differently. But we go to the government, to the National Task Force website every single day and see the updated numbers. So, so that's our first point of reference. And then every province has a website to to basically present the data from their own province. And sometimes that data goes granular enough at city level. And that's where we get more information than what is presented nationally. That's where we get the outbreak, the number of cases per city, the number of people quarantined per city, or how many tests have been done per city or per province. We get that mostly from the provincial website, and for that we have to scour information differently. Some of them have websites and they have it kind of nicely presented in graphs and charts or tables. Some of them have it as Instagram story, and so basically we have to take screenshot of that Instagram story before it goes away after 30 seconds. And then we manually kind of move the data from their platform onto our spreadsheet. Some of them do a daily or weekly press conference on YouTube, and we have to listen to those press conferences and then take note of the data manually and then input that into our system. So yeah, a lot of dedicated volunteers go into the collection of the data that we present on social media and also on our website every day.
Wow, that's just an amazing effort. Petra, what is your team doing to collect data? Where are they getting it from?
Very, very similar experience, and so what we've been trying to do is to automate it as much as possible. But it, as Ibu Alina said, it's actually impossible. Where there are sites that allow us to be able to draw data directly, and that's and it just creates so much efficiencies. But the majority data is not easily extractable. Sometimes they present it as images, for instance, and so you actually have to download the image or refer to the image and manually input the data. So yeah, but I think for me it emphasizes the underlying issues around capacity and lack of uniformity around protocols and procedures in presenting this data as well, Helen. So I don't fault the official. I think it's actually more of a system. It reflects more of a systemic issue underlying the data that's being presented, Helen.
So you have informal means or social media means by which you can find information. A lot of information from different governments being uploaded on social media. You have statements and so forth and so on, which then leads to a question that we've got from our audience. And if we could just put that up so that you can read that, because this is, of course, around how much is made, how much is private and how much is not. From Ayu Temanggung from HelloDoc, which is a tech startup in the health industry, if I'm not wrong. Where's the line between ethical and unethical data mining for COVID? Maybe Campbell, you can give us sort of an academic view on that, and then I'll go to our two other guests to see how they manage that question.
Yeah, wow, what a question. And this is the big question, I guess. And ethics in and of itself is a huge topic. I would say that we always have to be sort of cognizant of the environment that we're working in a pandemic situation. Individual privacy sometimes will come second to the greater good, the greater public good. So it's actually very, very hard to draw that line always. Just, I guess, from an abstract point of view with ethics, we always like to make sure that we obviously consider privacy, particularly when that data is potentially being used to obviously to identify individuals. We'd hope that we wouldn't need to do that necessarily, but also how the data is going to be used in general. If it's being used to make predictions that will affect people's lives, that will affect policy making, I think you need to be able to be completely transparent in how you're using the data. And I think that's the best answer to this, that as long as there's visibility of how the data is being used, how we can say that there are mechanisms in place to ensure that the predictions that are made are kind of made on quality data, that they're fair predictions, that we can explain what's going on. Also that there's some sort of human accountability. There's some point of accountability if something does go wrong, or if people have issues that they want to query about the way that the data is used. But it's a very big question. And I think at the moment, people and governments are having to actually make a lot of decisions on the run and make a lot of policy on the run, and yeah, just a lot of issues to consider.
Petra, how does this issue come up in your team?
No, it resonates very much. We think it's a huge issue where we've been actively trying to support dialogue or discourse around data protection and data privacy. So we're part of a global group that's looking at processes and procedures for this. And so I think it really underlines. So aside from before even looking at the ethical and unethical aspects of use of data in COVID-19, we also need the capacity of government to protect and ensure the security of the data is also part of this as well. And I know there was a case of data of private data being leaked on from one of the municipalities, and so I think bound within that conversation is about the capacity to ensure this data remains secure and protected. So it's still something that we really need to grapple with, Helen.
Alina, when you're looking at where you're getting the information from, the data from, do you also look at around whether it has been protected as much as it can be?
I would say all the data that we manage to collect, they're all anonymized. So we don't know who these people are. You know, they come to us as graphs or numbers or tables. There are provinces or cities that do their tracing well, and there's not a lot of cases per day. So they have the privilege of being able to not so much name, but describe each case. So for example, a 53-year-old male who recently traveled to which city was found positive upon arriving at the airport and getting tested. So, this person is now in quarantine, and, 3 members of his household is also serving quarantine, even though their test results haven't come out. So we have seen a record like that. Having said that, the data has always been anonymized. It doesn't mention kind of the locality or where this person lives to a degree where we can find that person or find the address. And I would say that compared to seeing the election data, for example, when I was about to vote and I wanted to check my status, whether or not I'm a registered voter already, I would say that this time around, there's a lot more care into protecting the privacy of the patient, especially because there's still a lot of resistance on the ground, and there's still stigma attached to, you know, kind of COVID-19, and we want to protect people from the possibility of having to deal with the disease and the psychological effect of it because of, you know, they're being stigmatized. I think this is a tough lesson that the government has learned from the way they announced the first 2 cases, of which they actually mentioned the name and the address of the people, and then kind of journalists basically went to their place, and then there is kind of like police tape in front of their house, and they've moved along, they've moved on well since then in protecting the privacy, unless the patient themselves decide to tell their story and you know, no longer be anonymous.
And the idea in Indonesia of privacy is it's more loose, I guess, is a word we can use. You know, people aren't thinking about it so much, but the coronavirus has highlighted where that privacy can be breached and cause unnecessary pain or extra pain. Gail, also interested in your comments around the government thinking more about the information and it getting out. And that comes, do you think they lost trust initially when some of that information came out that shouldn't have? Alina, and then Petra, and then I'd like to go to Campbell on sort of that wider messaging around trust.
There hasn't been any study if kind of the way the government handled the first few cases, or announced the first few cases, had an effect on people not wanting to get tested or not wanting to get traced, or, you know, reporting themselves even if they did an independent test and was found positive. So I couldn't say if there's correlation or if one caused the other. But, you know, kind of, but, you know, it continues to be our hope that the government protect the privacy of the patient, and, you know, kind of the patient makes the decision of whether or not they want to tell the story.
Petra, using data and for the reasons that you use it to have better humanitarian responses, trust is so vital in those situations, isn't it?
Yeah, it's critical, and I think also, you know, in what we find in Indonesia, in any given situation, there are always elements willing to use news or twist the news to their own narrative. And so I think this is why it's so important for consistent, clear and transparent reporting by the government to counter alternative or narratives, and using the situation to show that, to perhaps say that the government cannot be trusted, cannot be and to ignore some of the what the government is trying to do. And so again, I feel, as Campbell was saying, you know, it's not just the data, but the information that's derived from that data can be twisted in different ways. And so again, I think the emphasis on improving the way the data is collected and then presented is critical in building as a building block for trust in the state.
Campbell, how much responsibility do data scientists have in ensuring that this information is understood to be ethically collected, transparent, but is being read in the right way as well? So it's not being twisted, so to speak, looking at Petra's example.
Yeah, I think Petra makes a really important point, and that question of trust is really vitally important now, and in particular now when citizens are being asked, in many cases compelled by governments in the interest of public health to fundamentally alter their lives, even to the extent where they might have to give up their income, their social interactions, their lives as they know it. So anything that would erode that trust, and the trust is probably never there completely in the government in the first place, but anything that can erode that could potentially cause big problems in environments where, the fires of social unrest are already being stoked just by the restrictions and the situation, the pressure that people are under. So I think data scientists have a huge responsibility in this, because just as I said, you can make information from data. Of course, you can make misinformation from data. it's nothing new that statistics can be used to present certain agendas. Governments, politicians, everyone in public life potentially has been accused of using statistics in a way to push a certain agenda. But I would again echo that the key is probably as much transparency as possible, and open sourcing the health data as much as possible, particularly now. But I guess there are some caveats to that, in that there are some great organisations. Alina's organisation is an example of this, that are essentially citizen data scientists, just as there are citizen journalists, and that people are going in there and analysing the data and helping communities using data, and that is very useful. But I dare say there are others that maybe don't curate things as carefully. So there's a kind of a danger in, I guess, moving to some sort of lowest common denominator of data analysis and presentation that might be counterproductive. But I don't think any of those potential dangers outweigh the benefits of being as transparent as possible with the data, and the governments having frank conversations with their communities, because ultimately fighting COVID-19, it really is one of the greatest human collaboration efforts that we've ever seen, and we need everyone to work together, governments, communities, that everyone's interest is in getting this over as soon as possible. So again, I think transparency is key to maintaining that trust.
And looking at how this is one of the greatest challenges facing the international community, let alone Australia-Indonesia, but we do have a question around Australia and Indonesia working together on this. From Guntur Adi Utama, the University of Melbourne, what do you think Australia could offer to Indonesia in terms of cooperation in data management, and how can we make it work? And I also think Indonesia has something to teach us too around the availability of data and people on their smartphones, for instance. Campbell, if I could put that question to you first, though, and just get some follow-up responses from Alina and Petra, who are there on the ground looking at where the gaps are.
Mm-hmm. I suspect one of the areas we could cooperate on is infrastructure, data infrastructure, national platforms for data, because obviously a lot of this data will require consolidation and analysis at scale. So I suspect that's one of the areas that we could particularly cooperate on. There would certainly be learnings that would go both ways on this. I really think that the sort of work that Alina's talking about in community-centered data analysis and data discussions is really important, and Australia could probably learn as much as we could contribute to Indonesia on that. But I would say potentially infrastructure is something that Australia could contribute.
Right. I'm going to open up the chat box option too. Sorry, I didn't mention that. So feel free to start throwing your questions our way. Alina, I'll get you to follow up next.
Yes, I think kind of Indonesia is still battling is still trying to improve its testing and tracing capacity. So any collaboration in terms of, in a way that can make kind of testing data more easily digestible, or anything that can help testing capacity in some of the provinces. So that will be an area to explore, and also tracing, because even where testing has met the requirement, the tracing side of it still needs to catch up with it. And tracing does involve a lot of data on the ground, probably collected manually. But kind of a system where kind of the data of people who are being traced and quarantined and monitored goes into the same pool. So whoever is on duty can find the data easily enough to follow up on. So that will be another area for possibility. Another one not directly related to the pandemic is about bridging the digital gap in Indonesia. As many other countries are experiencing right now, we are having the debate of whether or not to reopen schools and how to reopen schools safely, because smartphone penetration in Indonesia is only at about 30% right now. So there are still a lot of people who don't have smartphone and probably don't have laptop at home or don't have reliable internet connection at home. And we know that remote learning can only work effectively when you have the infrastructure in place and you have the tools in place, the minimum being a smartphone. So anything that can bridge the digital gap while school continues to be at home. For example, kind of high-speed internet in every village or every neighborhood where kids can come, students can come and log in and do their schooling for a couple of hours and then come back, or making laptops more readily available. I'm not sure how much of that has been thought of by the Ministry of Education, but we haven't seen on the ground a collective kind of like a national or a collective effort to address the digital gap. So that's probably an area to think about as well.
Petra, systems and processes from the sounds of it.
Yeah, well, we're very grateful actually that DFAT and CSIRO we're progressing towards a partnership with them and so a lot of this is about utilizing tools that CSIRO has already developed or is utilizing, where we're able to then adapt based on our knowledge and also our networks on the ground in Indonesia. But at the same time, the prototypes that we've been developing utilizing alternative data sets in combination with existing traditional data sets then can become platforms where CSIRO is able to support us in then further developing or strengthening the back-end side of it and the security aspects, where I think Australia is very, very strong on particularly on data security and data protection. So that's also another aspect. But I was fascinated. Can I just a bit of a personal twist on this one, where I grew up in the highlands of West Papua, and I was fortunate to be able to get correspondence lessons from New South Wales. So there's more, on the ground, very practical aspects of collaboration based on the Australian experience as well as Indonesia's experience, where I think we should be able to explore as well, not just on the high level techie stuff. Just thought I'd just based on Elena's response, thanks, Elena. I thought, there's a lot of things on a practical level that could be done as well.
Very true. Good point. Yeah. And talking about the practical level, slightly different slant, though, we've been talking about data collection. But I'm wondering, have there been any restrictions put on getting that information? We have a question from the audience, Nigel Hembrough from Astronaut. With travel restrictions for the coming months and years potentially, how are academics collecting data from the field? Now, I know at the Australia-Indonesia Centre, we're going to our people in the field, but they're not travelling around. They're, I guess, securing data and information wherever they can on the projects that they're working with. But Elena and Petra, has it been harder to get information because of the coronavirus? Or is it a different situation that people are allowed to travel around? And then Campbell, what do you do if you're an academic and you can't be there face to face as finding the primary source of information? Elena.
Yes, a lot of activities or events in Indonesia that touch on the necessity of data and going on ground to people are actually happening concurrently. Indonesia is still in the midst of a national census, for example. There are regional elections coming up in November or December, including in Petra's hometown, and then at the same time, vaccination program nationally, it needs to continue, or blood donor program, it needs to continue nationally, especially this time around when people are more scared of donating their blood, for example. So kind of the Indonesian Red Cross is tasked with, you know, kind of being more proactive in going on ground. So yes, and a lot of that has been a challenge because especially outside of the urban centers, people still have to knock on doors. And it's a matter of how do we equip them to be able to do that safely? And how do we minimize the risk of resistance? People not wanting to open the door because they're afraid of contamination or things like that, or thinking that everybody knocking on their door is somebody wanting to test and trace and then take them away to quarantine center. So there is that resistance on the ground, and you know, kind of I have all my respect for people working in local government clinics, very limited resources, and they're trying to do everything they can to make sure that vaccination still continues, to make sure that you know, they still monitor people who are on home quarantines, even if by phone, because not many people have, in some areas, not many people do have smartphones. And so yeah, that's the realities on the ground for a lot of us in Indonesia.
Thanks, Elena. That's great insight. Petra, have you found that your research and as you go out trying to learn more about what's going on has been hampered at all just by the fact of what coronavirus is?
Hugely hampered. And I also want to acknowledge work undertaken by a number of civil society organizations, including, for instance, Copernic in Bali, Tulodo, I think, and
Tulodo,
who are also undertaking doing this sort of work in terms of, and their technique is usually through telephone surveys at this point. But again, it doesn't quite then cover the representation aspect, and of course, it's a very expensive and onerous process to go through. So what we're also excited is in looking at whether there are alternative ways to be able to analyze, for instance, economic activity utilizing satellite imagery. This is something CSIRO will be looking at with CSIRO, Data 61. And so again, whether there are alternative sets, I think it's what Campbell was saying before as well. There's a lot of data. How can we then use that data to then create information sets or bring out particular analytics that can help us inform, even though that data, the data wasn't specifically created for that particular use. So that's one aspect that we do a lot in Pulse Lab Jakarta, is trying to look at data and see what other information we can actually derive from that data, from existing data sets as well, or for instance, coming out of social media.
Campbell, I am almost afraid to envisage the amount of data that you would have to work with. But how do you collect it? How do you know where to go and what to look for in this sort of environment?
Well, I don't do sort of field work, I guess, and I would defer to you and to Petra and Elena on those sorts of collection questions. The sort of data that we're dealing with, for instance, in the lab that we have with the AFP, it's almost data that you wish you had less of. And it's unfortunately the case that during COVID-19, certain types of crime, without going into detail, very distressing crimes are on the increase, and there is no shortage, unfortunately, of data that we would need to deal with. So I guess I'm affected in a slightly different way in terms of the research that I'm involved in, and as I said, we probably would be one of the areas that we wish we had a bit less data. And
just to be clear, are you working with Indonesia in that AFP laboratory, so to speak? Are you working with international partners?
So we're a collaboration with the Australian Federal Police, and the AFP, of course, is tasked with investigating transnational serious crimes. So they certainly have a big network of partners. We at Monash also have a very big network of partners, and sometimes those networks do coincide, and we work directly with, for instance, international law enforcement agencies around the world. So what we try to do is, given that this has to be a collaborative effort, the sorts of crimes, countering the sort of crimes that we're interested in addressing, has to be transnational. We do work with a lot of partners. The interesting thing about that is that there's, of course, a lot of different local jurisdictional constraints in different areas that mean that you can't necessarily move data around between all those different areas very easily. There's a whole lot of legislative requirements around that, and there's also a lot of ethical requirements or constraints that mean that we don't want to move too much data around that relates to individuals, even if they're not identified. It's in some sense reusing that that data. So there's a really interesting sort of set of constraints. But yes, we do work.
Thank you. Yeah, slightly off topic, but I just think that collaborative idea and restrictions or possibilities around that was worth raising. Now, we've almost finished up our time, unfortunately, so I'm going to pose one last question to our panelists, and only going to give you 30 seconds to answer, just so that we don't go over. But we've been talking a lot about collecting data, how it's used, the messages it sends out to the public. And as we've discussed, it's very helpful having this data, but also how it's read is so important as well. And do you think that the current pandemic is shifting people's minds about the value of good data? And if not, what needs to be done, or what can be done to encourage more trust around, using the numbers to understand what's going on? Petra, can I start with you first, please? Because I know this is one of your areas of interest.
Okay, sorry. So
okay.
That's a very loaded question. That's a very loaded question, I think, Helen. So, I've actually just lost.
If I can put you, I'm actually referring to something that you said to me, so I'll be fair and tell you what that was. We need to start with small, actionable items that build momentum in trust with working together. The problem is that this happens with large, complex issues, and that takes time.
Yeah, but
and that's what you're facing.
That's exactly what we're facing, and I think. Has it actually changed the perception? That perception is being formed as we go by the level of accuracy, the level of transparency, and the way data is being used. So if it's used well and if it's presented well, then it will increase the trust and the way people will use data moving forward. But there's also the risk of it going the other way. So I think it's a challenge and why I think our work is critical is in helping to present that data well, and the information derived the analysis derived from that data.
Okay, thank you. Elena, a short answer from you, if you don't mind.
Yes, I second what Petra said, that we start small, and with our COVID, we start by informing presenting the data in kind of sizable chunks that is easy enough for people to understand. So in improving data literacy, essentially. And as more and more people are data literate, and they understand that they have the right to get this information from the government. It's actually enshrined in our laws that, when it comes to crisis, urgent situations, people have the right to get this data from the government. And as more and more people know that, then hopefully they will pressure the government more to reveal the data as is.
Good point, thank you. And finally, Campbell, to you.
I would echo everything that's said, and I think it's a huge positive that people are talking more about data. There is a data mindset. Who knows, who would have known that we'd be talking about R0 numbers and epidemiological curves and this sort of thing. I think it's a positive that people have this data literacy.
Well, it's been an absolute pleasure talking to a panel of data worms. so to speak. Thank you very much for your time today and for your insights. There are many more questions we could have got to, obviously a big area and something that we can follow up on as well, especially when we look at possible collaboration between Indonesia and Australia. And as Petra, you mentioned, those people-to-people links, you just can't beat them. I would like to thank everyone for joining us today as well and for taking part in the conversation. Thank you very much for your questions. We have a quick survey for you to do if you can at the end of this. And also a reminder that we make all our webinars available online. They're available for replay at Australia-Indonesia.com. We have a podcast as well of each event. So if you can't watch something, you can definitely listen to it, and we always try and write something about what we've discussed in these events. We do have another one coming up in 2 weeks' time on Wednesday, August the 19th. It's called Reimagining the Supply Chain, and again, really looking forward to this. We're going to speak to Tani Hub, who are an ag food startup company that's seen some amazing uplift in what it's had to deliver during the coronavirus pandemic, and talk to one of our fellows, Professor Nyoman, who's president of the Indonesian Supply Chain and Logistics Institute, and they've been doing some surveys during COVID-19 to get a sense of some supply chain issues. We will also hopefully have a third panelist, which we will announce in the coming 2 weeks. Again, thank you for your time, and have a lovely rest of the day wherever you are. We'll see you again soon.